Okay, great. Thanks again for joining the LIFE program webinar. I'd like to mention the several presenters we have with us today. Ben Loudermilch, Executive Housing Director at the Pennsylvania Department of Human Services. Jonathan Bowman, LIFE Program Director, Pennsylvania Department of Human Services. We have Joan Bradbury, Government Relations Senior Associate at DeBrunner & Associates. Bob Thiel, Government Affairs Manager at NEWCOURTLAND Senior Services. And Brian Urowski, Executive Director, Housing Authority of the County of Beaver. Ben, you could begin.
Great. Hey, thanks so much, Val, and thank you to the Pennsylvania Housing Alliance for hosting us on this call. We've done a number of these webinars showcasing some of what we've been working on with the DHS 5-year housing strategy. And as many of you know, that strategy is DHS's comprehensive plan to connect Pennsylvanians to affordable, integrated, accessible, and supportive housing. So when you think about this, the work that we're doing, we'll be focusing on 3 core populations. There's a great deal of overlap with these populations, and many of you serve these folks. But individuals and families who experience homelessness or are at risk of experiencing homelessness, individuals who have extremely low incomes and are rent burdened. But more specifically, when we talk today, we're thinking about individuals who live in institutions but could live in the community with housing services and supports. And we're not only thinking about folks who could move out of nursing care facilities, but folks who could be diverted or delayed in moving into nursing care facilities. And so specifically today we're talking about the aging population in Pennsylvania. So we see the LIFE program as a huge strategy in the implementation of the housing strategy. So without further ado, I'll let the experts talk about this, and I turn it over to Joan and Jonathan. Thanks, guys.
All right. Thanks, Ben. Good afternoon, everyone. Appreciate the opportunity to be on here and to talk about the LIFE program. This is Jonathan Bowman, and I am the director of the LIFE program in Pennsylvania. So just to give a little bit of background on the Office of Long-Term Living, the Office of Long-Term Living provides long-term services and supports to qualifying older Pennsylvanians and adults with physical disabilities. Individuals must qualify clinically and financially for all of our programs. So currently, the Office of Long-Term Living provides services through home community-based waivers, nursing facilities, and the LIFE program. And today we're going to focus on the LIFE program. So in Pennsylvania, we operate the LIFE program. The program is known nationally as the PACE program, or the Program of All-Inclusive Care for the Elderly. In Pennsylvania, when we opted to begin this program in 1998, we had to use the term, or the acronym LIFE, which stands for Living Independence for the Elderly, because a PACE program was already in existence through the Pennsylvania Department of Aging. It was a pharmaceutical program. So Pennsylvania opted to call the PACE program in Pennsylvania LIFE. So today we're going to be referring to the LIFE program. If you do any national searches on the program, you would need to use the acronym PACE. So just a little bit of background about what we're going to be discussing today. We're going to give a little bit of background on the LIFE program, talk about the LIFE program design, give you some facts on the LIFE program, and talk about eligibility and services, and then we can field any questions. So as I had mentioned earlier, the LIFE program was implemented in Pennsylvania in 1998. It was in the fall of 1998. So this fall we are actually coming up on 20 years of existence of the program. We do refer to the program as Living Independence for the Elderly, or LIFE. And as I mentioned earlier, the program is known nationally as the PACE program, or the Program of All-Inclusive Care for the Elderly. The program is currently Pennsylvania's only managed long-term care program in operation. That will change when Community Health Choices becomes operational, but currently we are the only managed care program operating in the state, and it's been that way for the last 20 years. But this program is very unique because it integrates Medicare and Medicaid funding through monthly capitation payments to providers. The program has dual oversight by both the state administering agency, which is Pennsylvania, and the federal government. So the program enrolls both dual eligibles and Medicaid-only individuals, and we pay on a monthly basis for individuals. A provider can receive payments from both Medicare and Medicaid. The program really is a risk-based model, so there is a huge incentive for the provider to keep participants as healthy as possible and in their home. We give a set amount of money each month from both the state and federal government, and the provider has to use those funds in order to provide services for the individuals. The life provider is responsible for coordinating and managing all of the participants' personal and health care needs. So just to talk about some of the services that the life program will cover, this really is a holistic model. So the life provider is responsible for all acute care services, which can include hospitalizations, doctor's visits, ER visits, long-term care services. This actually includes nursing facility services. So the life provider is responsible for providing long-term care services in a person's home, and if the person or their participant progresses to needing 24/7 care, the life program is required to have nursing facilities in their network and will contract with those nursing facilities to provide nursing facility care for individuals. Pharmaceutical services are covered, so all drugs and prescription drugs and Part D services if the individual's enrolled in Medicare. Behavioral health services are included in the program, and also social and community services. And a very unique aspect of the program is that transportation is included. So individuals that are enrolled in the program have essentially door-to-door transportation to and from the program. The program is focused around an adult day center. So each of our programs has an adult day center where individuals are brought into the center where they receive meals, therapy, they can meet with their physician, socialization, any personal assistance services they need there. And the provider will go to the individual's home, pick them up on one of their vans or buses, bring them to the center, and then take them back home at the end of the day. The goal of the program really is to enable older adults to remain in their home and community as long as possible. So now just to talk about the eligibility for the program. So these are eligibility criteria established by the federal government because this is a federally regulated program. In order to qualify for the program, you must be age 55 or older, determined nursing facility clinically eligible. This is done by the local AAA. Determined financially eligible or able to private pay. The financial determination is done by the local county assistance office. And you must reside safely in the community at the time of enrollment. So if an individual is interested in joining the life program, the life provider will meet with the individual and make sure that the provider or that the participant can be served safely in their home at the time of enrollment. And you must also reside in a service area that is covered by the life provider. So across the state, we have assigned areas or zip codes and counties to individual providers, and you have to live in one of those counties or zip codes in order to receive services from one of the providers. Later on in the presentation, we do have a map that shows the counties and zip codes that were assigned, so you'll have an idea if a life program is available in your area. And just a little bit about the average life population. These are statistics from the National PACE Association, national statistics, but 95% of participants that are enrolled in the life program or the PACE program nationally are dual eligible individuals, meaning that they are enrolled or eligible for both Medicare and Medicaid services. The average participant is an 80-year-old female. 90% of participants live in the community. So I mentioned earlier that the program does have in-network nursing facilities. Approximately 10% of our population does reside in a nursing facility while still remaining in the life program. but the large majority, at 90% of them, do live in the community and are served safely there. Also, the average participant has 8 medical conditions. Nearly half of them have dementia, and they have 3 activities of daily living. So now I'm going to turn the presentation over to Joan.
Hi, everyone. Joan Bradbury here from DeBrunner & Associates. I represent the Pennsylvania Life Provider Alliance, which is the Association of Life Providers here in PA. So it's the state association of the National PACE Association that Jonathan mentioned. Appreciate the opportunity to gush about our program here in Pennsylvania and really hope that our education and awareness of life here today in the webinar and other conversations we've been having across the state will really help you from a housing perspective think about the way that you can connect to local senior service providers in your area and hopefully form relationships, or at the very least begin to communicate with some of our life providers across the state. So I want to take a step back a little bit from, Jonathan spoke a bit about the eligibility requirements for the program, and this tends to be kind of, if you're not familiar with the way that the senior services programs work in Pennsylvania, sometimes it takes a little bit to get this, so we always like to kind of talk a little bit more about it to again give you a sense on how folks are eligible for our life program. So as Jonathan said, typical individual living in the community, eligibility for the life program is a senior over the age of 55. We always kind of joke that 55-year-olds probably don't consider themselves seniors. However, the program is able to work on some preventative services, being that it is a capitated managed care model. Folks that may begin to have cognitive or early onset Alzheimer's, for example, or in their 50s, may be eligible for the life program, and if that is the case, the sooner they are in the program, the better that our folks are able to begin managing their care and hopefully prevent a nursing facility admission at some point and help keep them safe in the community. So in terms of clinical eligibility, again, folks 55 or older otherwise would be eligible from their acute care needs to be residing in a nursing facility, but would prefer to remain at home in the community, and as Jonathan also mentioned, are residing safely. And our providers do work with the consumers to ensure that they have a safe residence. In terms of the financial eligibility, our providers work with the local county assistance offices to ensure that the individual is financially eligible. There are a couple different ways that you could be eligible for the program. Jonathan also mentioned about dual eligibility, meaning that you're eligible for Medicare and Medicaid benefits. We have the majority of our population, as Jonathan said, are dually eligible. We have another portion of the population that may not yet be eligible for Medicare, either because of age or disability reasons, and so they would be considered Medicaid only. And then we do have a small portion of our population across the state that do pay privately for the program. So taking a look a little more in depth at the services that are provided through the LIFE program, as Jonathan said, you have an individual living at home in the community. So we have our consumer here who is now, because they were clinically and financially eligible, is considered a LIFE participant. So within that program, they're living in the community. But really the program is completely person-centered. The individual works through what we call an interdisciplinary team, or an IDT, that the life provider has, every life provider has, that comes together on a daily basis to review the needs and concerns that they have about any of their participants. So in essence, as you are in the program and you have any changes in your care needs, say that you unfortunately had a fall or you've developed a medical disorder of some kind, you have a new diagnosis, you may have new cognitive concerns. As you age in the community, the services around you provided by the LIFE program can continue to change with you as your needs change. So the LIFE providers have an interdisciplinary team of all types of professionals. We have medical professionals where there is a physician on staff, nurses, we have social workers, we have nutritionists, we have all of your therapies, physical, occupational, recreational therapies, Jonathan mentioned the fact that our providers also contract with nursing facilities on the occasion that folks may need to have a short-term nursing facility stay. Our providers work with local nursing facilities to make sure that that individual has the care that they need for whatever period of time. The provider, similar to a managed care organization, is 100% responsible, both in pursuit of keeping the individual safe and in the community, but also financially at risk to ensure that the individual can be in the community for as long as possible. That being said, our life providers do cover the costs 100% of any of the care and services the individuals need within their established care plan, which is structured by the interdisciplinary team. So if an individual were to spend some time in a nursing facility, that's completely the responsibility of the life provider. Other services include within the day program, certainly socialization and fellowship, but also respite care for family. Sometimes we talk about the fact that a 65, 70-year-old individual has always liked to stay at home by themselves and read, doesn't really like large groups, doesn't necessarily like to socialize, and that's okay. Our providers work with their participants to ensure that they are participating in the program and receiving the services they need where they need them and where they would like them. So if I would really prefer not to go to a day program with maybe 20, 30 more other people throughout the course of a week, I don't have to. And I might be able to receive then those personal care services at home, where an individual from the life program would come to my home, help me get out of bed in the morning, bathing, dressing, grooming, help me around the house a little bit, and then maybe I do decide on a given day that I want to go to the day program and spend some time with other folks, or perhaps I have an appointment that day at the day center, and so the life program will provide that transportation to get me to and from the program. So in talking about housing and the ways that our providers work to ensure that there is safe, affordable housing for seniors, which is an eligibility requirement for the life program, it's important to understand that our providers are structured in a couple different ways. Some of our providers are what we call a standalone or owner-operated program, where they are not owned or organized in any way by a broader organization. They themselves are the provider. An example of that would be Life Pittsburgh in the Allegheny County region. We have some providers who are connected to hospital or health systems and are owned by those. Examples of that would be Life Geisinger or Mercy Life. And then we have providers that are connected to a broader long-term care provider organization, such as NEWCOURTLAND, who's going to be speaking later on in the presentation today. Based off of those program structure and how they work and operate their own contracts, our providers all do their own business organizing. So as the association, it's important for us to kind of give you a flavor of how our providers work in the housing space. This does not necessarily mean that every provider addresses the housing needs of their participants in the community in the same way, but these are some of the ways that our providers have worked over the years to address the needs of housing, which again is a barrier to access or a requirement to be in the life program. So different ways in which we do that is community partnerships or co-location agreements. We have providers who are actually co-located with a public housing authority building where they are connected in the actual structure of the building. The life program is connected to a housing high-rise. Example of that is Community Life in the western part of the state. We have other providers who have services and supports agreements. Senior Life has done this exceptionally well throughout the state as well, where they work with housing providers in the community to bring services and supports into those facilities, into those buildings. So if you as a housing provider are trying to ensure that you maintain capacity, that folks are able to remain in your housing, but that they're able to do so safely, and they might need a little extra support within their residence, there is an opportunity, certainly through their participation in the life program, that our providers could go into their actual housing setting, into that unit, and provide those services. which of course from a housing perspective would benefit you, that tenant would be able to remain there safely. I've mentioned a couple of these already, but certainly agreements with public housing authorities at the local level. We have other folks that work with HUD housing arrangements where there are life participants that reside in HUD housing high-rises and then attend the life program during the day, but all in all are life participants who receive additional services and supports in their housing unit. And then we have providers that also work with the nursing home transition program, which helps to take folks out of the nursing home and into the community and receiving home and community-based settings, kind of the perfect combination of an individual who would otherwise be eligible to live in a nursing home is really to be in the life program in the community and be able to receive assistance in that transition financially from the state to help get them into a safe, affordable housing arrangement, and then receive kind of that wraparound care of services in the community by the life provider, who will also be overseeing all of their changing care needs and providing all of those services in a coordinated and managed fashion. So we provided this link to you for you to, and we're not going to click on it today, but for you to take a look at on your own time. It's just a life participant testimony. It's a live link in the PowerPoint that you can use afterward. And really, when we talk about the life program, in essence, if a consumer in the life program doesn't really know how to describe what they're receiving from life, it means it's working. Because the interdisciplinary team and the life provider and the family members and the individual are just completely surrounding them with that care and services. And for an individual, that process should be seamless. So it's oftentimes hard for us to find participants that can really speak to the benefits that they're receiving of the program, but the individual in this testimony that you can watch on your own really speaks to the benefits that she has experienced personally, as well as the benefits she has seen to her family. So I'm going to turn it to Jonathan to talk a little bit about where we're located throughout the Commonwealth.
Okay, thanks, Joan. So this is just a map showing the life service area coverage across the state. The counties that are shaded in blue are currently where we have active life centers operating. The counties in red are where we are currently developing new life locations. So we're hoping that all of the counties in red by calendar year 2018 will be active in serving individuals. The counties that are striped are counties that have been assigned or awarded to providers but are not yet in operation. So the Office of Long-Term Living is working with those providers to ensure that we do get services to those counties. And then the remaining portion of the state are the counties that are in white are currently not assigned, and there's no services there. However, the department has made a commitment that we would like to see life services available to all counties across the state. So we have been working in collaboration with PALPA and our budget office to see that we can make services available to every individual across the state. So hopefully, I can't give a time frame, but in the next few years, we can see that life services are available to the entire state. So here, this slide just shows some additional information, some good resources if you're interested in finding more information about the LIFE program. You can find on the Department of Human Services website information about the LIFE program. The PALPA website is, I believe it's still under development, but will be coming soon. The National PACE Association has some excellent resources. And then, of course, the Centers for Medicare and Medicaid Services, since this is a federally regulated program, they have the federal regulations and a lot of information on their website.
Once our PALPA website is hopefully posted and finalized, we've just been undergoing a revamp of the website. There will be a zip code search as part of the PALPA website, so you can enter your zip code. Consumers, family members can enter their zip code and find out the contact information of their local provider.
Guys, this is Ben. Jonathan and Joan's contact information's up on the screen. Val, maybe if we could advance to Bob's presentation. I just wanted to make mention of the fact that when I worked locally as a housing provider, I would sometimes be concerned about the fact that folks who were living in our units and with the minimal supports could stay in the units longer. I wasn't able to identify these resources, and I came to find out that I wasn't alone in that, and that in fact these connections are now being made. Joan and Jonathan were kind enough to present at the PARA conference in late February, and we made some huge inroads with housing authorities where the penetration rate had been rather low. So if some of you work for housing authorities, Brian will speak momentarily, but I want to kick it over to Bob in New Courtland to talk a little bit about their experience and some of the work they've been able to do in the greater Philadelphia area. Bob?
Thank you, Ben. Again, my name is Bob Thiel. I'm the Government Affairs Manager for New Courtland Senior Services. We're going to talk today about our model of combining housing with supportive services, which is the LIFE program. Real quick, I want to roll through a history for people who do not know who we are. New Courtland history goes back well beyond a long time ago to the Civil War with the formation of the Presbyterian Hospital. In 1995, that hospital was sold to the University of Pennsylvania Health System, and New Courtland in its current form was created. Started off in the nursing home industry. The first goal was to improve the quality of life and care of seniors that they received in nursing homes. We began investing in nursing homes and eventually bought 7, but as our leadership went through this process, they saw that maybe this isn't the best way to take care of seniors, and we started investing in housing. In 2006, in 2007, we opened our first Life Center, and also, this was mentioned earlier by Joan and John, we started getting into the nursing home transition program. Again, seeing that seniors wouldn't be best served in this nursing home model, to get them out, keep them out of nursing homes, so we started to get more into the LIFE program. In 2013, we started to fully develop what we call our 15-year plan to provide 2,000 housing units for seniors in Philadelphia over the next 15 years. So as we go through this, you'll see more about that, where we're going, where we've been, and what our developments are. A few facts about our model. What we look to do is create a senior community which combines the LIFE program with affordable senior housing that allows the seniors, like we said earlier, Jonathan and Joan said the same thing, to stay in a place they call home for as long as possible. We worked with HUD to get a preference for our LIFE participants so that they would move at the top of these lists, our LIFE and NHT participants actually, so they could move to the top of our waiting list, and this way we can move them through faster and get them in safe housing as fast as possible. We fund our projects through a whole bunch of different sources, and these are some of the top ones: PHFA through tax credits, RCAP funds as well. We work with the Philadelphia Office of Housing and Community Development, private loans, New Courtland Investment. We're backed up by the Presbyterian Foundation for Philadelphia, with all the proceeds from the sale of the nursing homes and sale of the hospital go there, so that backs us up to make sure we can continue to do this as a nonprofit status. And also with the Philadelphia Housing Authority, you'll see later on in the presentation from another housing authority. We work with them closely with Kelvin Jeremiah, the CEO over there at the Philadelphia Housing Authority. We work with them for vouchers and different programs to make sure we get seniors in these apartments where they need to be. A few more facts. We offer 3 categories of housing to ensure that our seniors' needs are best met. Most of them are 1-bedroom and studio apartments, which are designed for independent living. We also have housing for seniors transitioning out of nursing homes. Again, as we continue to grow our model, you'll see that we're into this nursing home transition program, and it's becoming a larger part of what we do and kind of driving where we're going with this. And we also, as a special model, we have cottages on one of our campuses for people with dementia to live with the caregiver. So they're little 1-story, 2-bedroom cottages for those kind of people who need that kind of support. We like to talk about this model, and I think probably the reason we're here is because it falls in line with Governor Wolf's top priorities, the 5-year housing plan. As is stated in the plan, we connect seniors with affordable and supportive housing that keeps them out of nursing homes, and also community health choices. As everyone knows, the LIFE program is going to run right alongside community health choices, and the MCOs are required to have housing, and we're there already. We have a housing plan. We have a housing model to keep our seniors, our participants, in a model that allows them to have housing and the supportive services. Again, I spoke earlier about this, our 15-year plan, get as many seniors into housing as possible. Our goal is to have 2,000 units within 15 years. We started this in 2013. Right now we're about 265 units with around 150 to 200 in development. Now I would like to roll through our communities quickly just so you guys can kind of see what we have on top. The first one I want to talk about is our new Courtland Senior Community at Allegheny in North Philadelphia. This was opened around 5 years ago with just the Life Center. We, after about 2 years, we started building our units. We started with 65 housing units, and within the last year we built another 40 for a total of 105 on that site. We have room on this site to build another 100 to 150 units, and it's something we're always looking at. And you'll see we have other developments going on, so it's in the pipeline. Our second one, and this is our oldest community, at Germantown. This is where we have our cottages I spoke about earlier. We have 115 units here and an 8,000 square foot Life Center. This is a bigger campus than Allegheny, more wide open. It's very nice. Anybody who's ever been there could testify to that. It's a lot of green space, a lot of open area. It's a really nice feel, and the seniors feel very comfortable on there. On Germantown campus, we also have our one remaining nursing home, so we have that capability as well. If we have to put someone in a nursing home, we have that capability as well. Our third one of our apartments that's up and running is Cleveland in Northwest Philadelphia. These are 62 units. Although there's not a although there's not a Life Center on site, we do have a services on site coordinator to help seniors assist them if they need assistance with anything. I would like to next talk about our future developments. We have 3 in the pipeline right now, and well, actually 4 you'll see at the end of this presentation. Our first one, which is about 20% done in construction right now, is at New Courtland Senior Community at St. Bart's. This was a former Catholic school that we took down to the ground and are building from the ground up. Right now, it's set to have around 138 apartments with a 15,000 square foot Life Center. Again, we're replicating the senior community model, where seniors will be able to live right on top of the Life Center, be able to use the Life Center as much as needed, and they'll be able to go back and forth, and it creates a safe environment where they always know that help is right there whenever they need it. Our next development, this is a little bigger, 13-acre site in Northwest Philadelphia. This it was formerly known as the Eastern Pennsylvania Psychiatric Institute. We bought this around 3 years ago. We just actually received zoning to proceed with this project about a month ago. We're looking to start in the fall. A 13-acre site. There is actually room on this site to do up to 600 senior housing units on this site. Our first phase will include 78 apartments, 25 of which will be for nursing home transition, a 15,000 square foot Life Center, and this is also something different. We have enough room here for a commercial space, and we wanted to make sure the community's wishes to have some kind of commercial on this site were met, and we'll probably have some kind of medical use there. And we also work with the community on this as well. This was a lot of people were interested in this site. The community had a lot of plans for this site, and the way it went, it just did not fit into the retail aspects of what was going on in that area. So when we came in, we said we want to help you out still. We realized the community is very interested, so we did the commercial space, and we also are putting in a dog park for the community and a community garden as well. The next slide, we're talking about Lidenfield. This was a former housing project in Northeast Philadelphia, 33-acre site. Again, on this site, we're going to whack it up into 3 different lots. The first lot is going to be 250 senior apartments with a Life Center on the first floor. The second, third, we're making into athletic fields, donating to Holy Family. Again, you'll see this community aspect. We like to keep the community involved and make sure they know we're there for them. And the last third will be land bank for future use with community consideration. This was a big project. We actually just made settlement on this in the beginning of the month. We purchased it from PHA, and PHA is a partner with us on this project. And the last development I want to talk about, this is something new we actually just started doing. Around our St. Bart's community I mentioned earlier, there's a lot of smaller 600, 700 square foot houses, 1-story, that are occupied by seniors. So we're going in there, purchasing the homes for fair market value from the seniors and converting them into senior housing that we will oversee, and there'll be, again, life participants living in there. These are 1-story houses. We're remaking so it's ADA compliant. If somebody gets in there and they're not in a wheelchair, if their conditions evolve that they may need one, we'll be ready to serve them at that point. Lastly, I just wanted to thank you everyone for listening to what we had to say. As you can see, we're on our way with our 15-year plan. Hopefully within the next 15 years we'll have those 2,000 units. We have a few more developments in the pipeline that we're considering different properties. This is the model we're going with, and we think we can best serve the people of Philadelphia with this as a healthcare provider and housing provider. My contact information is there. If anybody has any questions at the end of the presentation, let me know. Thank you.
Hey, thanks, Bob. Just wanted to point out, Joan, you can say more on this if you'd like, but I did want to mention that New Courtland has developed some strategies that maybe aren't in existence across the Commonwealth. Love to see this kind of innovation, but different life programs operate in different ways and partner in different ways in each community. Joan or Jonathan, I don't know if you wanted to add to that before we kick it over to Brian to talk about his housing authority experience.
I think I mentioned it a little bit when I was speaking before, but it's a very good point, Ben, and appreciate you mentioning it. In the structure, New Courtland, as Bob was just talking about, is connected to a larger long-term care senior services organization. And so part of their senior services organization mission is in building and actually creating this affordable housing and then figuring out ways to partner that with the LIFE program to provide those services and serve their participants in the community. I think Brian's presentation will kind of give us a little bit of a different perspective on how Lutheran Senior Life out in the western part of the state approaches housing and working with the Housing Authority.
Right. So given that, and the other thing I wanted to point out, and Brian, you may mention this, but we had the opportunity to speak to personnel from the U.S. Department of Housing and Urban Development, and the strong consensus is that the LIFE program is very compatible for those of you who may operate in the public housing realm. So you may worry from time to time about taking on a vendor. The nice part about this is it's very compatible. You have only one choice of a vendor who's competitively procured over time, however, operates in that realm, county or block of counties. Brian, did you want to talk a little bit about your experience?
Sure. Welcome everyone across the Commonwealth to the webinar. I'd like to give everyone a professional plus a personal perspective of the LIFE program. As was said, in Beaver County, we're right north of Pittsburgh. The LIFE program is LIFE Beaver County. It's under the auspices of Lutheran Senior Life. Lutheran Senior Life also provides LIFE programs in Armstrong County, Butler County, and in Lawrence County. You have my contact information on the first slide there. I became the executive director of the Housing Authority just this past July of 2016. Prior to that, I was the deputy executive director under Carl DeCellis, the former executive director, for 20 years. So essentially, a lot of the programs that we've developed through the years were under the leadership of Carl. Currently, our LIFE program in Beaver County serves 354 clients. Now, the unique thing about the Housing Authority's relationship with the LIFE program is that in 2002, LIFE started in one of our public housing developments. We actually went through a disposition application with HUD and actually disposed of the upper 2 floors of an elderly high-rise building. And on those 2 floors, LIFE started their programs. And then after a period of about 3.5 years, 4 years, LIFE outgrew that space and moved to their current space that they have. Their LIFE Center now is situate in Center Township, Pennsylvania, where they have expanded several different times and now have the capacity of serving these 354 clients. Now, because of the fact that we established this relationship with the LIFE program, again, through Carl's leadership back in 2002, the LIFE program started to grab hold of in our county, and we had a lot of informational type meetings with the residents in our development. So as you see, the second bullet of this slide, it's showing that of the 354 clients presently serviced by the LIFE program in Beaver County, 101 of those clients reside in 24 housing developments that are either owned or managed by the Housing Authority. And that represents about 28% of the current life clients in Beaver County are residing in developments that we either own or manage. Now, one of the important things as being a management entity, whether it is you own and manage public housing, you own and manage multifamily housing, you own and manage low-income housing tax credits or other types of rental housing, one of the things that you always strive for is you try to reduce your turnovers and you try to reduce the number of vacancies that you have, because naturally when you experience a turnover, then you experience the cost that it takes to turn that particular unit over. Right now, we look here locally in Beaver County in our inventory that we can spend anywhere from $600 to $800 on average of turning a unit over. So therefore, it's important to try to keep our residents in place, and the LIFE program helps us in reference to that of potentially those residents who would have had to move out and go into a nursing home setting now are able to remain in place because of the services that LIFE provides. On the next slide, the first bullet, the majority of these 101 residents do reside in one of our public housing developments, or we do have some low-income housing tax credit developments. The Beaver County Housing Authority, we own or manage approximately 2,400 hard units of housing and another 600 units of Section 8 housing in the private marketplace. Of the 2,400 units of housing, about 1,850 are public housing units. So of those 24 developments that I'd mentioned that persons reside in, majority of those are public housing developments. So one of the features of those of you that are in the public housing arena or in the multifamily arena through HUD, if a unit is not occupied, you don't get any subsidy for that unit. So it's very important, and LIFE helps that if helping a person to remain in place and age in place, and then that has a benefit to the housing authority because of the fact that you're still collecting an operating subsidy for that particular unit. Now, one of the features, if you're managing or you own a low-income housing tax credit property, one of the things is you always got to be mindful of is that when you come to the end of a calendar year, that you don't want to have any vacancies either, because of the fact of how that may impact the tax credits for the investors in those developments. So again, participants that are residing in the low-income housing tax credit properties that we manage help in reference to staying in place and not having to move out and having a vacant unit at the end of the calendar year. So that second bullet there, I can't emphasize this more than enough that I can, and the fact that the life services enhance the ability of our residents to remain in place. And the importance of it is, an elderly person wants to stay in their home as long as they possibly can. It's the importance of living in your own home, and so life enables that to happen. Life enables that elderly person to remain in place in the apartment that they have been used to residing in and they're comfortable living in, and that's why that's so important and unique to the services that life provides. But what is also interesting, as you've seen through the previous presentations and what I've witnessed myself of what I know of various life programs throughout the Commonwealth, is that each life program is unique to its location. And it's unique to its location in reference to the talents and the abilities of the various partners that partner with the life provider. So it ends up becoming like what Courtland has or some other types of developments. It can be a very unique and different type of setting. Though the services are the same, the settings and the provisions of the service can be unique to the individual locations. And of that, in reference to speaking to that uniqueness, with Life Beaver here in Beaver County, in the developments that we manage, there are two developments that Life, because of the concentration of life participants that reside in those developments, Life has made a decision to staff those developments 24/7 with their own people, with nursing staff, CNAs, site supervisors, that sort of thing. So essentially, it provides an additional layer of support and services to enable those residents that reside in those developments to remain in place. And that from a management perspective, enhances our ability to be able to manage those properties, because we know that those persons are receiving those additional services, as well as my management staff or my casework staff can communicate with the life staff that's on site and speak to any issues relating to those particular residents that are residing in those developments. Now, shifting gears from the professional to the personal, my next slide, my mother has been a life participant since December of 2010. And this past Sunday, we celebrated her 94th birthday. Initially, she rented an apartment in the private marketplace, but she now resides in one of those developments where Life has staffing 24/7. I am the youngest of three in my family, and both of my parents, my father has since passed away, both of my parents are totally deaf. So my mother, with her being totally deaf, and she was also diagnosed with Alzheimer's. So being a Life participant, a Life Beaver has stepped up to the plate in what I can only say is in a very exceptional way of providing the needed services in my mother's situation. As was mentioned, with the Life Center that they have in Center Township, and what I know of the needs of our elderly residents, that one of the most important needs of an elderly resident is the ability of socialization, of being around other persons, if they really want to be out and about and socializing. So Life provides that. For my mother, they transport her 4 times a week to the center in Center Township. While she's at the center, Life has arranged that there's an interpreter there with my mother for the entire time that she stays at the center, so that she can participate fully in all of the programs that Life provides at the center. And then just recently, Life has also now provided an interpreter to come and visit my mother on Saturdays, just as a type of socialization, activity. The other thing, as was mentioned in previous presentations, in my mother's situation, all of her health care needs are paid fully by the Life program. My sister, who is the oldest in our family, is my mother's power of attorney, her medical power of attorney. And my sister communicates on a regular basis with the entire Life team. And that's a very important part of the Life process, because of knowing that Life team of doctors, social workers, nurses, and staff are meeting in a holistic setting and discussing the needs of all of their participants. And my last point, and this would be said of many of the folks that participate in the Life program, if my mother was not a participant in the Life program, she would be definitely in a nursing home, rather than being able to still live independently in the apartment that she has, even though she is down, and she's down that road of Alzheimer's quite a bit, but she still, because of the services that are provided to her, is still able to live on her own, in her own setting, and that's something from the family's perspective, something that we want to see continue as long as it possibly can. And it's just phenomenal what the Life Beaver program has provided for my mother since she enrolled in December till now, and as we as a family have seen her health deteriorate over the years, Life has proportionally up the services that my mother needed so that she can continue to remain in place in the apartment that she lives in. So that's my perspective.
Brian, thank you so much. I think having that personal touch is incredibly important, given your personal experience. I didn't know if a lot of details covered here, 2 great life experiences, and then the department's perspective as well as Palpa's. I don't know if folks on the call have any questions about the life program and why we think it's so incredibly important.
Hello, this is Valerie. I just want to remind folks you could do *7 to unmute your lines. I do notice there were a couple questions that were typed in while presenters were speaking, so I'd like to just read those for you. The first one was directed to Bob. Are the seniors you are buying homes from staying in the homes after you purchase them?
If they qualify for the life program and if they qualify for vouchers, then definitely we would like to keep them in there. No one's being forced out of any homes. We got a couple questions like that. No one's being forced out or anything like that. If they want to sell it willingly, we'll work with them. And if they qualify for our program and for affordable housing, then yes, by all means, we'd love to keep them in there.
Okay, super, thank you. Then someone asked, would you please speak briefly on how life handles the transition of military veterans or other seniors who have received their care through the VA or other places, how those persons are transitioned into the life program, and are there senior services, prior service providers such as your primary care, other specialists integrated into the individual's life plan?
Val, I can tackle that question, and then maybe Jonathan will probably have something to add as well from the state's perspective. But we actually have been doing some research recently about the partnerships between life programs and the VA. We actually now know that we have 4 of our life programs across the state have formal provider agreements with their local VA medical centers. This is actually a process that providers can go through with the Federal Veterans Administration to have these partnership agreements where folks that are receiving some of their services through the VA can actually also be life participants. So there's a formal agreement process that the 2 entities undergo. From the life program's perspective, it actually is extremely helpful to also have that VA partnership, certainly the ability to serve some of those folks in the community, but also the fact that the VA covers some of those services like durable medical equipment. Certainly our life providers help and ensure that the individual has everything that they need, but kind of that combination of services and programs and equipment that both programs can kind of complement each other, we found that those have been extremely effective partnerships. The other question that kind of ties right into that you had mentioned from the individual as well, talks about continuity of care kind of requirements and what the provider networks are like through the life program. Certainly our providers have made a commitment that if an individual is already receiving services for kind of a long-term or acute medical condition, cancer as an example, and they're already undergoing treatment, our providers work to ensure that their oncologists certainly would continue to be able to provide those services to the individual even when they become part of the life program. We get that question very often, that there is a lot of concern and question. Certainly somebody that has seen their same primary care physician for 40, 50 more years, there is a concern certainly of needing to give up that doctor to come into the life program. And in reality, because all of the services and medical care is provided holistically through the life program, it actually winds up being a strength and a benefit of the program that all of that is coordinated within. But we leave that up to the individual providers. They do maintain their networks. Jonathan, I don't know if you want to add anything from the state's perspective to how some of that continuity of care works.
Yeah, I mean, I think you did an excellent job answering the question. We do, from a department perspective, monitor contract adequacy or network adequacy on the providers, but there's often many times where, like Joan had mentioned, oncologists or someone where someone's receiving ongoing treatment, that they'll work with, if that particular provider is not within their contracted network, that they'll go out and contract with that provider just to ensure continuity of care.
Thanks, guys.
Val,
are there other questions?
I don't see any other questions, but if people want to unmute their lines, they could do *7 to ask a question to any of the presenters.
In the interim, Val, do you mind if I add something?
Sure.
One of the comments I think that Ben had mentioned before was kind of how do the programs come about across the state. And he mentioned that there is a procurement process with the Commonwealth. Pennsylvania is very unique in the fact that the only time our providers really compete is during that procurement process, where they may be interested in expanding into a new county, new portion of the state. That being said, essentially based on your zip code, that local provider is your life provider. I would also encourage folks coming at this from the housing perspective that whether or not you saw on the map that there is a life provider in your local county, or whether or not a program is developed, certainly reaching out to those providers just to initiate the conversation, learn more about how they operate locally, certainly an opportunity to connect within your local community and just start those conversations.
There is another question that came in. Does Life have education, nutritionist, and fitness services?
Jonathan, you want to take that?
Yeah, sure. Yes, Life does have dietary services, nutrition services. It's really a very holistic model, and our Life providers are responsible for like the whole picture of a person's health. So they'll work with an individual on education as far as nutrition, dietary, fitness. There's physical therapy rooms, exercise rooms, usually in the Life centers. So it really does go above and beyond just the traditional, home community-based waiver services or the traditional acute care medical services. It's a very big picture program.
Other questions?
Looks like maybe one came through.
Oh, yes. Are people diagnosed with serious mental illness eligible?
That's a great question. We don't typically see a lot of individuals with serious mental illness in the program. But again, this is up where we, as the department, leave this up to the individual provider on whether or not they can safely serve the individual in the community, and whether or not their array of services can meet the individual's needs.
I'll also add to that, Jonathan, two thoughts. One is that in the increases that we're seeing in the long-term care world overall, is a lot more folks with some cognitive or Alzheimer's diagnoses. And our providers have started to look at different ways that they can better serve those populations and their needs within their programs. So, for example, some of the Life Day Centers might have designated areas for folks with Alzheimer's diagnoses where there's maybe a little bit lower lighting, a little more relaxing of a setting, not so much going on. So there's adaptations like that that we've made within the individual programs to be able to serve those folks. The other thing I'll mention is that at the federal level, CMS has been working on a program with states that are interested in providing a life-like model for folks under the age of 55, in which case they would have either a mental illness, mental health diagnosis, or even intellectual disabilities or autism diagnoses to be able to provide a life-like model to those individuals.
That's great, Jonathan. Thank you. Val, we're at the hour, so at this point in time, if folks have other questions, the PowerPoint will be sent out and contact information included in that. And if those of you who know me, feel free to reach out to me as well. Or if you don't know me and like to talk to me, that's fine as well. But really appreciate Joan, Jonathan, Brian and Bob for taking the time to speak here today, and thanks again to the Housing Alliance for making the arrangements for this webinar. It's always a pleasure to work with you guys. And thank you for everybody who joined us for on the call today.
Yes,
thank
you're
you.
very welcome. It was very informative, and you're doing some great work around the state through this program and services. And again, thank you, everyone. We will be getting this out to you most likely on Tuesday, and I want to wish everyone a happy long holiday weekend.
You too. Thank you.
Okay,
Thank you.
thank you. Take care now. Bye-bye.
Bye.